This is one of the fastest growing cities in Canada. The population is booming as thousands of more people call Brampton home every year. But for decades, past governments stalled on expanding health care right here in Peel Region.
Premier Doug Ford announced he will be investing an additional $21 million towards expanding capacity and improving services at the William Osler Health System in Brampton.
$18 million of this funding will help to create a fully functional inpatient hospital right here at Peel Memorial. That means a new 24/7 emergency room and acute care services will finally be available to this community.
$3 million will be invested to enhance the Cancer Care Center at the Brampton Civic Hospital. Ford says the new investment is in addition to the $18 million announced last year, which was also meant to help Peel Memorial's emergency room turn into a 24-hour operation. The Premier adds the government plans on investing more than $30 billion over the next 10 years to build and improve Ontario's healthcare infrastructure.
And here's what it means for the people of Brampton. It means that there will be 250 more hospital beds after so many years of waiting for their fair share.
With more beds, Ford promises more medical professionals.
Our government is adding 160 undergraduate positions and 295 postgraduate positions to Ontario's medical schools, the largest expansion in more than 10 years. And we're building a brand new Ryerson School of Medicine that will open right here in Brampton.
NDP Deputy Leader Sarah Singh says Ford has delayed investing in the Brampton Hospital until just before the election, adding these funding announcements won't be in the province's budget this year. NDP leader Maleeha Horwath is promising universal mental health coverage if her party wins, with a yearly price tag of $1.15 billion. The pandemic highlighting just how broken the system is.
Mental health services, supports, and treatment just haven't been there for people. Wait times are painfully long, and once you get to the front of the line, soaring out-of-pocket costs put mental health services out of reach for far too many people.
Horwath says mental health services will be brought into OHIP. In addition to benefits to an individual's mental health, the NDP says its plan would save billions of dollars because community care would lessen the need for critical care.
Right now, over 500,000 Ontarians with mental health needs have no access to counseling or therapy services because they don't have insurance. So that's where we'll start. We'll work with existing community-based providers to bring them into the publicly funded system. We'll ramp up funding to train our doctors, nurses, community healthcare workers, and social workers so we can increase the number of available mental health practitioners.
The NDP says their immediate investment into universal mental health coverage would be $500 million. By year 4, when the plan is fully implemented, it would be $1.15 billion annually. The NDP says it will also tackle wait lists for children's mental health care. For City News, I'm Maleeha Sheikh.